Namaste all. Superhero, a person with a superpower. We can all be a superhero in someone's life, but for that, we need some skills. So today, on the first aid day, let's learn some basic of first aid by one of our highly trained and passionate critical care medicine specialists who is certified in infectious disease control by the Royal College UK. He is awarded remarkable list of awards and numerical publications. I request Dr. Parth to please guide us and train us in first aid basics.
Okay, hello everyone. Thank you, Dr. Suchi, for the kind introduction. So, let's start today's session. Okay, so to begin with, today we are assembled here on the occasion of the First Aid Week. The First Aid Day is actually on the 9th September, and the entire week is celebrated as the First Aid Week. So, on this occasion, let's take a moment to reflect on all that can be done before doctors actually arrive and before the patient actually comes to the hospital. So, today I will give you some hints, some tricks, some tips on how to become a superhero in someone else's life for an entire lifetime. So, let's start. So, first aid in Gujarati Pratham Sarwar. So, why is first aid important? If you ask someone that, if someone has, let's say, an injury, or if someone falls down, or if someone, let's say, doesn't understand what is happening, is confused, someone has some strain, someone has some any other form of trauma, then why is first aid important? Can't doctors or hospitals always take care of patients? So if you ask me this question, the answer is a straight no. Whenever there is an injury or a trauma or an event occurring, the hospital or the doctor can never always be present on site. So when such an event or such an occasion comes, the patient needs to be shifted at a place where he can receive urgent or emergent care. And while doing this, the person who is actually shifting the patient can harm or help the patient depending on how skilled or how knowledgeable he is. So my purpose today and in this occasion is to guide you in such a way that some tips and tricks everyone, medico or non-medico or a normal lay person, can also implement in their day-to-day lives and can actually help in saving a life along with medical care. Okay, so let's start. So the objective of today's session is that whenever there is a certain collapse or a certain incident in specifically active working or people who are engaged in their professions. So whenever there is a sudden change, let's say a person was working 15 minutes back and he had a sudden chest pain, he fell. So that is an acute sudden change. So we expect the cause to be reversible if something is done in time. Whereas on the other hand, if we see an old fragile lady who is, let's say, 95 years old and who is gradually declining in consciousness, who is not responding lesser and lesser every day, so such a person, if they become unconscious, it is as per time. So when there is no acute change occurring, we might not be able to do a lot. But when there are acute changes in active or working people, like talking, dancing, playing, following their professions, walking, anything, so those are the patients or the people we can help the most. And apart from that, as I already mentioned, that doctors or paramedics cannot always be there anywhere. Okay, and let me tell you one more thing. Whenever we say paramedics, each and every one of you is a paramedic. So that is our aim in the Resuscitation Council and HCG Hospital motto, that we want to create one lifesaver in every household. So this is one such movement to help that larger aim. So now if we have learned some skills, then we can maybe help the person reach a safe place where resuscitation or care can be taken. So let's just have an outlook as to what can be done in this acute scenario. So whenever there is some injury happening, it can be a trauma, it can be a heart attack, it can be anything. Our aim is not just any recovery or survival. Our aim is good neurological recovery. For example, if a person just is alive by a rhythm on an ECG strip, but is not able to interact, not able to recognize anyone, not able to talk, then such a life has no meaning. So that is what we say when we say that is a bad quality life. So our aim in resuscitation, in rescuing, in first aid is good neurological recovery, not mere survival. Okay, so I hope this is clear to everyone. And before I forget, questions are always welcome, but please mention those questions in the comment section so we can handle all of them at once later on. Okay. Now, when we say or when we talk about good neurological recovery, so why is CPR essential for that? So CPR, for those who don't know or those who are not aware, is cardiopulmonary resuscitation. It is much more than just pumping the heart manually. So that is one big issue which we need to understand and grasp. But CPR is essential because it more often than not saves lives. So once the life is saved, then comes the question of, is the life saved with a good neurological outcome or with a bad outcome? But saving a life is the primary thing. So that is the first thing. And second, CPR is surprisingly easy to learn. So I'll tell you some basics about compression only life support, which is a must for every citizen of India. It should be there. It's not regulatory or it's not compulsory as per the law, but I feel it should be a must from your heart, because that will help you and that will equip you with some skills where you can not only feel confident in any emergency, but you can also help people and families at once. So whenever we talk about cardiopulmonary resuscitation or helping the needy or helping a patient or helping other injured people, the first and foremost thing is safety of the provider. Provider means us. So whenever we see an injured victim and we rush to save the victim, or we rush to help him, or we rush to shift him to a safer surrounding, we should first see our own safety. There is no point if the provider gets injured in a much more threatening way than the victim himself or herself. So as you can see here, these are examples of such scenarios where the victims are very, very seriously injured, but we cannot effectively go there to resuscitate them. Maybe the gym or the treadmills are the safest ones in the picture, but apart from that, I don't think anyone is a safe place. The hotel, yes and no, because there is no space to actually make the victim lie down very well. So we would need to clear up space for that also. So always remember safety first, and safety of the provider before the safety or the uh, chance to help the victim. So your own safety is the first priority. So this is what I was saying when I said calls. So calls is a compression only life support, which is usually meant for paramedics, non-medicos, any citizen of India. So it is some sort of a life support which can save lives just by basic recognition of unconsciousness. So that is the first thing. And the Indian Resuscitation Council is our own national body which generates guidelines based on recent and based on Asian data. So till now, if you would have been aware, the resuscitation guidelines were always written in the Western world. So now that there is an era, there is a time where we all must change. And this is the start of one such big movement, that the Indian Resuscitation Council has programs from compression only life support to basic cardiovascular life support to advanced comprehensive cardiopulmonary life support. And all of them are based on relevant and more recent guidelines. And all of them are equivalent to the Western literature or the American society or the German society or any other society. It is valid internationally. So today I'll give you some idea of the compression only life support. So whenever we teach you any sort of a life support, be it be basic, be it be compression only, or be it be comprehensive, so there are certain steps, and those steps we try to call them links. When we say links, we basically mean that one step is incomplete without the other, or the other step ultimately pulls the first step. So whenever we talk about links in this compression only life support, it's recognition first, followed by chest compression if there is recognition of an unconscious or an unresponsive victim. And once that is started, as soon as possible, the transfer facility or the transfer mode has to be arranged. And if you notice closely, each and every name here has the word early. So the earlier you recognize, the earlier you call for help, the earlier you activate the medical help system, the earlier you can start chest compression and the earlier you can transfer. So early is the most important word in this entire scenario. So, what to do when we actually start approaching such victims or such patients? So, whenever we start approaching such a victim, after ensuring a safe place, please be very, very sure that the place around the victim is safe for you, as shown in the figure, that there is no imminent danger to the provider. So what will we do? We will check response. Response can be in terms of simple movements, simple verbations, or it can be in a simple sign such as heavy breathing, deep breathing, cough, blinking of the eye. It can be anything. So we need to be ready to see and to assess response in all possible terms. And how do we make sure that we have actually made our best effort to start assessing response? We actually tap on the shoulders of the victim. We cannot tap anywhere, just on the cheek, head, anywhere, because that might lead to more of an injury than not. So we tap on the shoulders, which is a safe place to tap and it doesn't cause more injury. So after tapping, we ask loudly, hey, hello, can you hear me? So something like that, in probably the language with the victim understands. That is another important thing. If you are a traveler or if you are at a place where the language is different and you don't know it, you might have to rely on non-verbal commands. So that is one thing which has to be kept in mind, that the victim should actually understand what you are saying. Okay. So once we know that there is or there is no response in either scenario, the first thing to do is to call for help. So as you can see in the figure, the first one is the scenario where the victim is unresponsive. Actually, both are a scenario where the victim is unresponsive. But in the first one, there is no one available to the bystander for help. So he is calling out for help to one person he sees far away. So if you ask me why is that important, because if that person without calling for help starts supporting the victim or the patient, then he himself as a single provider cannot continue for a very long time. And when there is such a scenario on a road in the middle of nowhere, you don't know how long you might need to continue it and to what end. If we cannot shift the patient in the stable and safe condition to the nearby medical facility where advanced care is there, then giving CPR for a prolonged period and without help makes no sense. So for everything which is relevant to us, we need more help. One person cannot run the show. So that is what he's doing in the first photograph, that he's calling to the nearby visible pedestrian for help. And that is actually the best thing to do, being a paramedic or even the medic in such a scenario, because that person can also help you contact other healthcare facilities, like you see in the second picture. What if that bystander has a phone and you don't? So it's become so simple. You can just activate the emergency number, call 108, and the ambulance or the healthcare providers can be there faster. Okay, I hope this is clear to everyone. So this particular slide was made because a lot of evident data was there where calls were made that so and so person has fallen down here, so and so person has been injured here, or so and so accident has taken place, but help could still not arrive in time. So that is when we had to include this in the guidelines, that what to actually say during a call. So we first identify ourselves. I am so and so. I am from this location at this road or this junction, or how however you can help the healthcare providers or the emergency activating system to reach you. You can tell them, and then you can tell the victim's primary condition. No matter how little you understand, that the victim is unconscious, victim has been hit by a bus or anything, so you can tell them. And the second most important thing is to tell them the number of victims. So we know that we need one ambulance or more. That is also very important, because essentially one ambulance will have everything necessary for one victim or one patient. They might not have the tools needed to serve a lot of patients or a group of patients. And apart from that, the age, gender and complaint is important. Why? Because sometimes there are kids, there are smaller populations, there are females, there are pregnant females So you need some other specialized doctors for that, you need specialized equipment for that. And whenever there is a special scenario, you might need more than one resuscitator. So if you tell them that this is the scenario and this is the number of victims we are dealing with, they might be able to increase the number of rescuers they send. Okay, and once all this is conveyed via call, the most important thing is to not hang up until you are asked to do so. Because until you are asked to hang up, and if in case you hang up before it, then those data might not be recorded. Okay, so this is one thing worth remembering: only hang up when you are asked to do so. So now the process of chest compression, I feel, is fairly simple. I'll show you in a while in the mannequin. If you would have seen, it's behind me. So basically the process of chest compression is trying to compress the victim's heart in such a way that it does its normal function. So what is the normal function of the heart? To pump blood, and primarily to various important organs like the brain, the lung, the liver, the kidney, and the heart itself. Yes, heart itself needs blood to survive. So if you can see from the figure, whenever we try to pump the victim's heart, the elbow should be straight, shoulders should be above the victim's chest, and if possible interlock the fingers. The reason to get this posture is it is the only ergonomic posture where you can go for a longer time without fatigue by giving effective chest compression. Okay, if you want to learn more about this, this entire calls course is available for anyone to do it, and there are specific centers and specific faculties like myself all around India who teach them. So we can always schedule it, and HCG is gladly going to support us in this. But these are the small details which matter. The devils are always in the details. So this is actually a short video which will make things pretty clear in your head. To video. Okay, so somehow there is some technical issue. So my capable colleague here, Mrs. Suchi, will try to explain how compression is carried out. And if you can see behind me on the mannequin, that is where she'll show it. So as you can see here, she is first trying to approach the victim. So once you approach the victim, you try and sit at a place where it is easier for you to give compressions. And once you do that, then you put your hand at the xiphoid process and two fingers at the xiphoid process, and then try to put both hands in an interlock position on that. First, we have to check the response. Hello. Hello. So there's no response. Then we can check for a pulse. And then start. We have to place our hand straight, and then we can give compression. 1, 2, 3, 4, 5, 7, 9, 10, 11. Okay. Like this, 30 compressions we have to do. So, okay, so 30 compressions are one cycle. So 30 compressions should be given unaltered. So once we do that, and then we try to look at other things where we can help. Next. Okay, so now as she showed us, after response checking, what if the patient is actually responsive? If the patient is responsive, then we cannot just leave him or her there, even though he is responsive. We have to turn the patient in a position where there is lesser harm to him going forward. So this is the position which is shown, basically turning the victim to one side and with one hand over the other. As you can see here, it is the best position to keep a victim in before you call for additional help. So always remember in this that your two hands can save lives very, very easily and very, very certainly. So when you try and practice this, always remember these steps. I say again: first, ensure safety for your own self. Then second, approach the victim in such a way that you can check response by tapping on the shoulder, shouting out, or trying to ask them, are they okay? After you check response, checking the pulse is dependent on whether you can actually locate the pulse. So being a bystander, you might not be able to locate the pulse, and that's fine. Even if you cannot locate the pulse, when the victim is unresponsive, just ask for help and initiate the calls algorithm that we saw prior. So when you do that, what happens is that you start helping the victim in such a way that more damage doesn't occur than what has already been done. So once that is done, you are actually helping the patient achieve a good neurological outcome. So I think that's all from my side. There are a lot of other scenarios such as these where there can be simple strains, sprains, there can be massive accidents, traumas. There can be a lot of scenarios that happen. And it is next to impossible for me to teach everything in such videos or such lectures. These are meant to just maybe tickle your brain and to make you think that such scenarios can be handled by even lay persons and non-medicos. So we will be posting small videos of each of these scenarios in the coming weeks, starting from Monday. So it is in toto a health series by HCG where we post one or maybe two videos a week. And the next one is, I think, the most common one, strains and sprains. So I'll tell you basic things about how to handle it and how to approach a victim where additional damage can be prevented. Sometimes what happens that if suppose let's say a heavy object is on the victim, you just cannot negate that damage, you cannot undo the damage. So what you can do is prevent further damage from happening. So sometimes that is also enough. So in short, I hope this first aid week gives you a certain message that it's time that we all get involved in the medical management of all patients, and we all as lay persons or paramedics can also help in altering outcomes. So questions are now always welcome. Okay, so we have one question where they have asked first aid for choking in babies. Okay, so this is a scenario which we teach in comprehensive life support, but I'll tell you the basics. First, we sometimes if it is post some meal or some feed, we try to turn the baby on one side, and if that is not possible, we try to do the Heimlich's maneuver, which is done usually in adults, but there is an altered form of the maneuver being done for babies as well. So I don't have a child mannequin here, but if you want to know more regarding this, you will have to join our comprehensive cardiovascular life support course where we teach this in detail on feedback mannequins, and we also teach you the finer points where you can understand why we are doing what we are doing. Next question, please. Okay. Okay, so the other question is also regarding pediatric BLS or CPR. So as I said previously that we have a separate course for it. It is not included in general compression only life support. So you will have to attend our workshop where we teach pediatric BLS or CPR. Okay, so we have one more question where they are asking, is the heart attack same as cardiac arrest? Okay, so let me explain two different terminologies here. Myocardium is a word we use for the heart. So there are two terminologies, ischemia and infarction. Ischemia is reduction of blood supply, and infarction is complete damage to the tissue where blood supply has ceased. So whenever there is some irreversible damage to the tissue where blood supply has ceased for a sizable amount of time, it's called an infarct. And simple reduction of blood is ischemia. When we say heart attack, it can be any of them. It can be anything from myocardial ischemia to complete myocardial infarction. So effectively, the cardiac arrest is complete stoppage of the heart. Let's say the entire heart has stopped receiving blood and has stopped functioning. So that is cardiac arrest. Heart attack is not always cardiac arrest. If we do something when the patient or the person is having a heart attack, we can prevent a cardiac arrest. And the percentages have been studied for a very long time, let's say 50, 60 years. So if let's say 10 people with a heart attack come, you can maybe prevent arrest in two of them, which is a sizable number. You'll be able to save two lives. So No, they are not the same. Okay, so someone is asking me, is BLS certification required to perform a BLS? So the answer is a big yes, because you cannot be telling people or knowing something without actually being audited. Let's say it's like asking a student who has studied till 12th, not given the exam. Would you say that he's a student who's passed 12th? No, right? So that is the same scenario with a BLS or even a CCLS or call certification, that you cannot say that the person is certified until they receive a certification from an accredited body. So as I said, the Indian Resuscitation Council is one such body which has guidelines from India and Asia, and which gives certification to lay people for calls, for paramedics and some medical students for BCLS, and to the doctors for comprehensive cardiopulmonary life support, which is CCLS. So it is a big yes that certification is required to perform a BLS. So again, for the pediatric person, yes, we can give compression to pediatric patients as well, but there are various techniques like the double thumb technique or the two finger technique, which are different than the adult. So again, it's not possible to give you all the details right now, but for more details, the pediatric BCLS or the CCLS workshop is what you should attend. Okay, so interesting question. What if the patient doesn't respond even if you finish CPR cycle? So, okay, so what do we mean by one cycle of CPR? One cycle of CPR is 30 chest compressions. And if you have another helper with you, then you might think of giving breath. Otherwise, COLS is only compression. So, 30 compressions is one cycle. So, when we start giving such cycles, and if there is one rescue, let's say I get tired in 3 minutes, and if the patient doesn't respond, but if I am exhausted, there's no option but to stop. But if we have multiple people giving CPR, and in spite of activating the emergency system, there has elapsed a sufficient time where there is no response seen in the patient, that sufficient time is very, very ambiguous and there is no fixed number, but I would say 45 minutes is a time you should follow. That if there is no response even after close to 45 minutes of a CPR, you need or you can safely stop, because there are scenarios where CPR needs to be continued for a longer time, let's say hypothermia or snake poisoning or something like that. But in normal scenarios, either the provider gets exhausted, or a sufficient amount of time where we can say or reliably say that there is some irreversible damage to the brain. So, one of those two scenarios, we stop giving CPR. Okay, so the other question is also an interesting one for a pregnant woman. So, if the pregnant woman is, let's say, third trimester or maybe second trimester end, then yes, we need to take certain precautions. So, the certain precautions we need to take is pushing the uterus to one side. And which side, if you ask me, it should be the left side, because there is a lever which doesn't allow the uterus to be shifted, or the abdomen to be reliably shifted to the right. So one additional person pushes the abdomen on the left side. So he has to either push from the right to the left, or he has to pull from the left. So either way, you displace the abdomen to the left side. You may wedge, you may not wedge, but once you have displaced, you start and continue CPR the same way you do in any adult. And one more very big change in pregnant women is you have 5 minutes where you can actually do an emergency cesarean section. So it is very, very important, and I would say quintessential, to call a gynecologist, an obstetrician, along with a pediatrician whenever a pediatric woman is being resuscitated. You might need to do a cesarean section, and the kid who will be born, or the kid who will come out, might not be breathing or might not be in an adequately normal state and they might need immediate pediatric assistance. So whenever there is a pediatric woman being treated, you need to call an obstetrician and gynecologist and a pediatrician. Okay, so seems we have no more questions. So it's thank you from my side for now and see you soon. Bye bye.